If I were still in Ghana today looking for opportunities to travel to the UK, to the US and Canada as a nurse or a healthcare professional, considering how it has become difficult for health professionals to come to these high-income countries, this is exactly what I would have done. I would explore healthcare remote jobs. And in this video, I will show you why it could be the smartest move for you. We will dive deep into healthcare or medical virtual assistant roles. I will break down what it is, how it works, and how you as a nurse or healthcare professional in Africa already has what it takes to do these jobs. According to a report by the Future Market Insights, this industry is expected to grow from 1.4 billion in 2025 to 19.2 billion by 2035. You will learn why this is the best option for you right now, how to become one, and the exact action plan to start today. What is a healthcare or medical virtual assistant? A healthcare virtual assistant is someone who works remotely to support medical professionals with administrative tasks. You will do things like handle patient enquiries, schedule appointments, manage medical records, assist with billing and insurance follow-ups. Now tell me the truth. Haven't you done any of these things already in your position as a nurse or healthcare professional in your country, Nigeria, Ghana, Zimbabwe, or wherever you are? Yes, of course, you have done them. So you see why I tell you you're already qualified for these jobs. I remember back in Ghana when I was working in a private hospital as a registered nurse, I used to receive calls from patients inquiring about our services, book appointments, bill patients when they are discharged, and even coordinate various clinic activities at our satellite clinics, all by just phone call. Remember, just after handover, in charge will come and stand on you to phone the patient that were discharged the previous day and even 3 days ago to find out how they are doing, how they are getting along with their medications and stuff like that. And these are the things medical virtual assistants do. You see, you already have the qualification to do these jobs. We have people who are not medical professionals, they don't have any medical background, and they are doing these jobs and are making up to $25 an hour. What is stopping you who have the medical background, you have experience in the field and understand these kind of things better? They just study basic medical terminology and the processes that goes on in the clinic and hospitals or healthcare settings, and voila, they are at the job. But you have the real patient experience, you have knowledge of common medical conditions, and you have the medical mindset. So you are overqualified. And if you live in Ghana or Nigeria, earning about $10 an hour can be very transformational. Plus, I know several nurses who have passed their CBT plus IELTS. Some have even traveled to the UK to do OSCE, and they are still struggling to find jobs. And what is even painful is that there are people in Ghana who have passed NCLEX, and it is taking them about 3 years to do the process to be able to move to the US. While you are waiting for this process to come to light, why not take advantage of these virtual jobs? How do you become a healthcare or medical virtual assistant? Let's walk through the 3-step action plan. Number 1 is to research and understand the healthcare or medical virtual assistant role. Go to LinkedIn or Indeed or the other job boards, search for these jobs, read the job description, take note of the skills and the tools required of you to be able to perform these duties. Number 2, learn the skills. Once you have read several job descriptions and have a list of the skills required of you and the tools you need, if you don't have any of those skills, then you need to go and take online courses to obtain those skills in order to start applying for these jobs. You can check platforms like Udemy, Coursera, Allison.com, and even just searching on Google for specific courses, and you'll find a lot of them, some free and some paid. Some key courses to focus on is Virtual Assistant Fundamentals, Medical Terminology, HIPAA compliance for US, GDPR training for UK, medical billing and coding, and AI for healthcare admins. This one is not really required, but if you know where the world is going with artificial intelligence taking over everything, you will see it very beneficial to take this course because it will help you in delivering your jobs very fast. If you know what is good for you, you would want to add artificial intelligence to everything you are studying. When you are taking these online courses, make sure you don't focus on just the certificate. Oh, I want to finish this course fast and get certificate. The certificate is not what is important, because most employers are not going to give you a job based on only your certificate. They will give you a job based on your skills, based on your experiences, based on what you have done before and what you'll be able to do. Focus on learning and understanding the content of the course and practice to be able to do what the course tells you to do, so that when you start your virtual assistant job, you'll be able to deliver to the expectation of your employer. My number 3 action plan is to build networks and connections on LinkedIn. Optimize your LinkedIn profile with keywords like medical virtual assistant, healthcare virtual assistant. Connect with recruiters and individuals who are already in these jobs, and then join remote work communities on LinkedIn to stay updated with the trends and the new updates. Most of the time, the jobs will not even get posted on the job boards or even on LinkedIn, but by virtue of your connection with people who are already doing this job, you'll be able to have access to these jobs firsthand. If you are finding any value in this video, pause for a second, click that subscribe button, click the like button so that YouTube can show this video to a lot of people. Now that you have an understanding of who a medical virtual assistant or healthcare virtual assistant is, and you know how to become one, what should you do next? Go to LinkedIn right after this video and create an account if you don't have one. If you already have an account, go and optimize it. Put a very nice photograph on your profile and search for virtual assistant jobs. Look at their job descriptions and understand what they are looking for. Enroll in courses. Once you are studying these courses, start building connections with people on LinkedIn and having genuine communication with them, so that by the time you would have been done with the courses and understanding the job and how you should go about it, you would have built connection with people who are ready to give you jobs. How easy is that? Now let's recap all I've been speaking about for the past minute. We spoke about who a medical virtual assistant is. We said they work remotely and earn about $10 to $25 an hour. And I've proven to you that you already have the skills and the experiences required to go into these jobs. I've shown you the targeted courses you can take to start working in these fields, and then the action plan you should take to start this journey today. If you have watched the video up to this point, I am Bright Agbenyo. I am on the journey of becoming a high impact man. If you are interested in knowing every step of the process, then subscribe to the channel to become a part of the family. Like the video and share to that next friend of yours. Share it to your class page, share it to your church platforms, so that people in your community can explore these opportunities. Thank you and see you in my next video.